Welcome to the Specialty Pharmacy Podcast. This Specialty Pharmacy Podcast is a collaboration with the National Association of Specialty Pharmacy, the NASP, and the Pharmacy Podcast Network. The mission of the National Association of Specialty Pharmacy is to improve specialty pharmacy practice by promoting continuing professional education and certification of specialty pharmacists, while advocating for public policies that ensure patient access to specialty medications. As the healthcare industry's leading podcast dedicated to the pharmacy profession, the Pharmacy Podcast Network is proud to bring our listeners the Specialty Pharmacy Podcast in partnership with the NASP.
Hello, this is Miguel Johns with KingFit, and you're listening to the Pharmacy Podcast Network.
Welcome to the Pharmacy Podcast Network. I am the founder of the Pharmacy Podcast, Todd Urey, and today we have a returning sponsor who's been very special to the network and very supportive to the network, the CEO of KeyCentrix, Eli Khalifi. Eli, welcome back to the podcast.
Thank you, Todd. Thank you for the amazing work that you do on a daily basis, bringing pharmacies and networks together to service an industry that needs more than what we can deliver to it. I'd like to welcome Miguel Johns. Miguel is with KingFit. He's the CEO of KingFit, a Kansas company. It's a startup. And Miguel will tell us a little bit about the background, why he created this company, what engaged him, and what he is doing. And then throughout the discussion, we will talk about the interest of the healthcare industry in global for services such as what Miguel provides and how they integrate from a technology perspective to benefit all the actors of the ecosystem. So welcome, Miguel.
Thank you.
Tell us about KingFit and what you guys are doing in the diabetes space.
Yeah, so for people with diabetes, KingFit is a mobile application that delivers industry-leading diabetes education to the palm of your hand. And the reason we are taking this approach to diabetes is I have a passion for diabetes. My dad has it and my grandmother as well. When my grandmother was diagnosed with diabetes, she had told me she wanted to eat healthier. She said that she would no longer be consuming fruit juice or chocolate milk, and instead would be exchanging those for not very healthier options. And so for me, I had an instant light bulb as I was already studying exercise science at Indiana State University. I noticed that there was a big gap in between when somebody was diagnosed with diabetes and when they actually understood what they needed to do to have well-managed diabetes. And that gap led to lots of problems, including a much higher risk for developing the side effects of having diabetes, such as neuropathy, loss of vision, or renal failure. And it also led to those patients getting worried, stressed, depressed, and returning back to that healthcare organization, which of course costs the U.S. healthcare system more money. And so with our application, our goal, when someone is newly diagnosed with diabetes, which there are 5,000 people diagnosed every day just in America, instead of being sent home with a piece of paper and a good luck, they can leverage our application and really understand what's going on with their chronic illness. And so when they have that next interaction with their provider, it's a much more educated interaction. They can get a lot more value from it, and they can work together to have well-managed diabetes.
What better way to engage a patient than our mobile phones? Because that's part of our lives in a way that really, unless you're, I don't know what the age range is, I want to say 22 years old, you probably don't remember a time that you didn't have a mobile phone in your hand. I'm 45, so I definitely remember. Matter of fact, I remember the clunky first phone that I had that cost, I think, $5 a minute or something like that. If we don't meet patients where they are, if we don't come to the patients where they are and help them use tools that make sense to them in their daily lives, just like medication adherence, it's not going to be sought after. It's not going to be followed up with. And what do you know? If you're not tracking your diabetes, then it could blow up into a much more serious problem. Having toes amputated and your health risks and the stress on your heart and everything that comes along with that. Ellie, you guys are technology providers. KeyCentrix has been in technology, pharmacy technology for some time. Why was this an important subject to bring to the table?
Well, anything that we do at KeyCentrix is geared toward the patient, number one, and then toward the pharmacy and the improvement of the pharmacy as a whole, improvement of the healthcare system. You talked about medication adherence. You have a lot of patients that are taking their medications, but also diverge completely in how they use their food, if they exercise or if they do anything. And we know that diabetes is one of the major factors for heart failures, heart disease, kidney and renal failure, pancreatic problems. So it's one of the major issues in the U.S., major issues in the world. In the U.S., coming back to the U.S., there is the factor that the prescribers don't spend enough time explaining to the patients and educating them on their diseases. They basically have a patient that will go to the physician will examine them, and basically he gives them the diagnosis and tell them, okay, you have to take this medication, let me send it to the pharmacy, you go fill it and you take it and you come and see me in a month, without any further interaction, any further directions on how to manage it properly. Tools like what KeyCentrix provides helps the pharmacist to track this information, definitely to receive the information from the EMR system, and also create extra fields so that they can manage the patient's health, information about what they are doing. Sometimes the pharmacist will spend the time to counsel the patient, and from time to time, specifically in independent pharmacy, in community pharmacy, you have a little bit more hands-on from the pharmacist to the patient, so there is a little bit more interaction. But the pharmacist doesn't have enough time to spend with every patient to give them the proper education. So the interest of KeyCentrix in including and interfacing with patient education platform is essential, specifically when we talk about specialty pharmacy, what is required in terms of outcome, follow-ups, and reimbursement from CMS or from the insurance companies, the private insurance companies, and the effect of the manufacturers in terms of subsidizing some of the work that the patient is getting in terms of keeping the education and keeping the outcome out there. So today, and I'm going to let Miguel talk a little bit about his application, what it intakes, and then we can talk about how it merges into New Leaf RX and the pharmacy systems and the benefits to every actor in the ecosystem.
So Miguel, definitely, I have some questions before we get into that. But Miguel, you come from a position of passion. I think of my stepson who's going to be launching a clinic this summer for other high school athletes. He's a football player in college, and he is dedicating his summer to a healthcare clinic for high school football players. You played for Indiana State University. You know that if you don't measure how you are progressing as a football player, that you're not going to be able to get better because you can't really track things. That really pulls back into the world of diabetes. You were passionate about this. You were you watched a program called Escape Fire about a documentary about the struggling healthcare system, and it really drove you to action. It drove you to building what is this application to really engage patients at their level in tracking their diabetes. So tell our listeners about that and how that came to be.
Yeah. So as you mentioned, I got a full scholarship to play football out at Indiana State. And so I completely understand that really sparked my entrepreneurial process. The college football life is a 100% 20-hour-a-day dedication. And so I had those basic building blocks to be an entrepreneur. While I was there, I was studying exercise science, mainly because of my dad's health. He has type 2 diabetes as well. My grandmother was diagnosed while I was going to school there, so that just added to the fire. As I was in my chronic disease management class, we watched the documentary Escape Fire, which featured Dean Ornish, and it talked about how if we didn't do something very quickly, the healthcare system would soon be unsustainable. And the reason for that, as Ellie mentioned, providers didn't have the time they needed to spend with patients with chronic diseases to actually help them get better. And it wasn't any fault of the providers. It was a system that has just been put together the wrong way for today's world. And at the time, it may have been right. But now these providers were calling out for help. They're asking people to provide new resources, to bring new technologies, to be entrepreneurs and help change the U.S. healthcare system because it was just falling to pieces. And so that really inspired me to look at diabetes, since that's what I was really passionate about, and think about how I could help there. I was already a personal trainer and a college strength and conditioning coach while at Indiana State, as well as a nutritionist. And so I was doing some online coaching, and I decided, you know what, I could just take the same setup and partner with physicians and coach their patients through a lifestyle change. And I did that for about a year. But what I was really testing during that year was the power of video. So you mentioned meeting patients where they are. When I really looked at the healthcare system and how diabetes education was attempted to be done, and there's a big reason why 95% of people don't get it when they're newly diagnosed. The three reasons we found that to be were: one, 1,500 counties in the U.S. don't even offer DSME accredited programs. And so there's just nothing in the community that can support the patients. The second reason is a lot of insurance companies just don't cover the cost of a structured DSME program. And so patients are asked to pay $300 to $500 out of pocket. And then the third reason, which I think is actually bigger than the first two, is the inconvenience. And so patients are asked to come sit in a classroom for 3 to 5 hours and learn about diabetes. And nobody wants to do that in their free time. And so what I was fascinated by as I was going through this journey is I spent a lot of time learning things on YouTube, which of course is just blown up in regards to surpassing even television. And if you have a kid or grandkid who's under the age of 15, they may only watch YouTube, and just because of the convenience and the free choice of what you get to consume. And what I was really fascinated about with YouTube was that there are these educational channels that had millions of subscribers, 10 million subscribers, 8 million subscribers, and they're education based, and they'd be talking about world history and mathematics and things that you wouldn't think people did in their free time. And so I reached out to these channels and I asked them, how are you able to get so many viewers and so much engagement on your content? And it came down to delivery. And it was the factor that these educational channels were taking the experts' knowledge, the industry leaders, and they're turning them into bite-sized pieces of content that were fun, animated, and engaging. And so that sparked the idea of, well, what if we could bring that same style to healthcare and educate people about their chronic disease in a way that would help them be able to manage it better and avoid a lot of the complications. And so I started testing video with my online coaching service. And as I started presenting that to the community, I've had great advisors and investors come forth and point us in the direction to actually think a little bit bigger. And so one of my advisors challenged me to not pursue an actual coaching platform, but to turn it into a technology that we could then automate and help a lot more people without needing a bunch of coaches to do so. And so it started with that Escape Fire documentary, but YouTube played a huge role in how we decided to put together our application. And it came down to, what world do we live in today, which is people are very busy and convenience is king, especially looking at YouTube and Facebook and things like that. And how do we bring that world to healthcare in a way that would be accessible to everybody? And so that's how we got to where we are today.
That is really interesting. It reminds me the way that we service our pharmacy customers with the customized abilities to build workflow and platforms and software customized to them is exactly what you did with patients suffering with diabetes. And I think that's the merge point. I think that's where the data that you're collecting could become invaluable to a specialty pharmacy or to a community pharmacy or to a community pharmacy diabetes educator who wants to be able to tap into the data for 30 days, 60 days, 1 year's worth of data for their patient to be able to help that patient manage their diabetes better. So bravo to you, Miguel. That's incredible.
Miguel, without naming the manufacturer, explain a little bit the value that you are going to bring with the help of this manufacturer to the community and what you expect from them.
Yeah. So what's really interesting about our technology, and this was a piece of value that I didn't even realize as we were building this project, but they brought to my attention. Diabetes is a global problem. There's actually 370 million people with diabetes across the world, 30 million of those people just in America. And there's, unlike America, a significant lack of resources. So we're lucky enough in America to have 30,000 diabetes educators, which of course isn't nearly enough, but there's still something there. In these other countries and other parts of the world, they don't even have that. And so we have been approached by a recent potential partner who wants to turn our content into international content and potentially create KingFit for Latin America, which will then allow us to provide diabetes education from industry experts to a part of the company that has 40 million people with diabetes and provide them with a resource that they previously had no access to. So what that will allow us to do is that it'll help a large population of people who have no guidance and help them better manage their diabetes so that they can interact with their providers who may not be diabetes educators, but are still trying to help them have better health. And that's a new potential opportunity for us to then replicate in other parts of the world who are also lacking significant resources. And the idea with our application and the content within it, all of the content's created by experts who have published over 20 books, over 300 articles, have started diabetes businesses of their own. It's actually really simple when you get down to how the education is impacting these patients. We educate them about what the signs and symptoms are of problems they might experience. For example, hypo and hyperglycemia is a huge problem for people with diabetes, and it often causes people to call their provider or schedule another appointment, which costs money and which is very avoidable, especially if the patient's educated on what's going on. Or the signs of neuropathy, which of course, losing a foot is a big problem for people with diabetes, and a lot of people don't even know what's going on until it's too late. Or the signs of loss of vision. And so a lot of those things we can easily cover in our application, and then that patient can have a much more educated conversation with their provider and avoid coming back for unnecessary meetings. On top of that, we're teaching them how to eat better, how to portion, how to understand food labels and things like that that will really help them manage their blood glucose levels. I spent some time on Diabetes Connect, which is an amazing forum for people with diabetes, and 9 out of 10 of the posts were people with diabetes calling out for help in regards to what they were supposed to eat. You see people diagnosed with diabetes and they're told you need to eat less sugar, and then they eliminate the sugar from their coffee, but then have a loaf of bread and just don't understand what sugar really is and what a carbohydrate is. And so that's a big piece of what our application is doing. And there's a big problem in the diabetes community for people experiencing depression, because they feel like they've let other people down or they've let themselves down. And how could they ever let themselves be diagnosed with diabetes? Well, we have a behavioral aspects piece of our app, where we have an amazing psychologist who's actually the co-founder of the National Behavioral Institute for Diabetes. And we really work on the mindset of what it means to live with diabetes and try to help people who are dealing with diabetes burnout. So that's not only the newly diagnosed, that's somebody who may have been living with it for 30 years and just feels like enough is enough. I'm done managing this. So we really try to hit on all the aspects, from the fundamentals of understanding what the heck your medications are and what you need to be asking your provider, to what you need to eat, to how you need to safely exercise, and to how you can best mentally deal with the problems you're going to experience. And with what we're doing, we want to have the providers involved as much as possible. So we'll be tracking the view time of their patients and be able to deliver that back to them so they can reach out to the patients who are unengaged or congratulate the patients who are really taking action to have well-managed diabetes. And so we want to create that we want to be a piece of the system that exists and just do our part to make it a little bit better.
So when it comes to the technology, Miguel, today it's a mobile application that is educating the patients. And it is, how much does it cost to the patient?
Yes, so the app is free for the patients, and that was a big part of my passion piece about this. There's a large portion of people with diabetes are from low-income backgrounds, and so we wanted to make sure that it was going to be free for the user.
Okay, and what are you tracking today? So you're providing the training, you're engaging the patient, and how do you track if they are using it or not?
Yes. So right now we're tracking the view time analytics. So we know which videos people are watching, how long they're watching them for. And that's where we're starting so that we can easily provide that back to providers. If they recommend that a patient should watch phase 1 and phase 2 of the nutrition program, we can let them know if that patient did watch phase 1 or phase 2. We can deliver them back those analytics, and they can reach out to them. Or if their patient's following the care plan, then they don't need to, and they can wait till that next meeting. So we're starting simple, but of course we'll continue to add on based on what the providers want to see and what features the patients are interested in. So
KingFit, the application is tracking the patient education that they are watching those sessions, and then has the capabilities of transferring this information to be stored within the pharmacy system and the EMR EHR system, allowing the prescriber to get the benefit of the patient education without them spending the time to counsel them, right?
Correct. Yep, correct. And to give an example of a workflow, we have a pilot set up with a group out of Kansas City, and their vision of it, as well as ours, is somebody's newly diagnosed. They have the initial meeting with the provider, who then walks them through the pieces of content that would be most beneficial to them in their situation, and then prescribes them that content. And as they view that, we deliver those analytics back, and they can easily check, did patient A or B engage with the content we wanted them to? And if not, we need to reach out to them because they're unengaged. And for the patients that did, then we're good to go.
Miguel, if I'm a pharmacy owner, a pharmacist, a healthcare provider listening to the podcast, and I want to get this information, this application in the hands of my patients, what's the best way to direct a pharmacist and or the patient in engaging KingFit in the KingFit application? Yeah.
So a patient can easily download the app from the App Store. Now, if a pharmacist or provider wants to best leverage the application and gain insights to their patient population and make sure they're engaging, the best way would be to contact us. And you can do that directly through our website, or you can contact me directly via email. And that way we can set you up with your own personal access code, which you will then provide to your patient population, so we can deliver you back your view time analytics. But there is the option, if you're not concerned with the view time analytics, to just direct your patient straight to the application in both the Apple and Google Play Store.
And I'm looking, and I'll make sure that this is in the show notes, KingFit.io. So it's KingFit.io is your
Correct.
website. And then you can go to the Apple Store or the Google Play Store and put in KingFit, and it probably will come up. Is there any keywords that they use, like diabetes or anything like that?
Yeah, so KingFit Diabetes Education.
Excellent. I'll make sure that that's in the show notes. Ellie, I can see where this can go. It kind of excites me to think of the pharmacy management system side of this, helping to collect some of this data and blowing it up to a whole nother level.
So they are all interlinked, and thank you so much for asking this question. The information that is coming from the application from KingFit will be stored in terms of compliance in the pharmacy system, allowing the pharmacist and the pharmacy to be compliant with CMS and what is required to get a bigger reimbursement and to get more compliance and outcome both to the patient and to the pharmacy for repeat business. With this information, not only are we looking at the engagement between the pharmacist and the patient, but also readmittance to hospitals. So everybody in the ecosystem will benefit from something like that. The insurance will benefit from it, and I'm assuming that the insurance is the one that after the patient will be the most, will have the most benefit because they are getting more training and the patient is not being readmitted to the hospital. They are getting a better member into their environment. The prescriber is making, I don't know, correct me if I'm wrong, Miguel, but is it $65 per 20 minutes?
Yes, and so if we look at the opportunities in regards to billing, if they use the chronic care management codes, they can receive up to $67 for 20 minutes of the engagement within the app.
And it's not costing them labor. Literally, you have how many patients are being seen by a pharmacist and a prescriber on a daily basis, and how much time can they save not spending the time with the patient or not having the labor that is behind spending the time, just getting an application. The patient can use it anytime that they feel they are ready to use it. If they are in a hurry, they don't need to wait at the physician's office or the pharmacy. Yet they are accountable because the application is tracking what the behavior of the patient, and it is reporting back to the ecosystem. So the benefits are all over the ecosystem, honestly. So we are very excited to have such an application being integrated in the pharmacy system, and I highly would like to push to all the prescribers to take this idea and follow the steps of what we are doing and help patient education using the phones, using the electronic materials that are provided to us. So using technology. The other question that I would like to ask Miguel is, we talked about medication management, the metformin, the insulin use. So give us a little bit the guts of what would the patient see when they use your application. Just give us some snippet.
Yeah. So for example, one of our educators, Teresa Garnero, is actually the author for the American Diabetes Association book, Your First Year with Diabetes, and she does an amazing job. One of the videos comes to mind specifically called The 4 Types of Diabetes Medication, and she breaks down all the different medications you may experience if you have diabetes and what each medication does, what you need to be aware of, as well as our other educators come into play because they talk about how exercise affects the use of those medications and how nutrition affects the use of those medications. Now, to be super clear, they're not giving any recommendations on how much medication you should take or how often you should take it, but they make it very clear to understand the signs. For example, if you do decide to have well-managed diabetes through nutrition and exercise, and you notice that your blood sugars are unusually low because you're also taking medication, they talk about how to bring that conversation up with your provider. And so they're really, really big on educating them about what all those medications are, how to best deal with them, and then how to be educated in that conversation with that provider so that that provider can update your care plan to the way it needs to be to best serve the patient. And so that's something I'm really excited about because I haven't been able to find information like that in the way that they've delivered it anywhere on the internet. You can find information about carbs and exercise and the basics, but the way that they've explained understanding medication in our application, I believe, will lead to increased medication adherence. We haven't ran the studies on this yet, but just my intuition tells me that it's going to improve how patients interact with their medications and how they can communicate that with their providers.
Gentlemen, I think this has been a very interesting topic to discuss and relevant to the importance. Ellie, thank you so much for sponsoring this podcast that I think is extremely important to pharmacy providers, pharmacy owners, pharmacists out there. But to blast this through multiple networks that we have. Miguel, be on the lookout for additional questions that might be coming your way from other pharmacists. But thank you both for participating on the platform and sharing your knowledge about diabetes and the technology that KingFit provides.
Thank you.
Thank you. Thanks, Todd.
You were listening to the Pharmacy Podcast Network, sponsored by KeyCentrix. You can find KeyCentrix Pharmacy Technology Platforms and Management Systems at KeyCentrix.com. And we thank you for listening to the Pharmacy Podcast Network.
Thanks for listening to the Specialty Pharmacy Podcast. Be sure to share this podcast with your fellow pharmacists, doctors, and healthcare providers dedicated to optimal patient care. If you have ideas for future episode topics, please email the Pharmacy Podcast Network. Send your message to publisher@pharmacypodcast.com.